Chronic care management is an important component of primary care that contributes to better patient satisfaction and outcomes. Today's module will cover what chronic care management is, which patients can benefit the most from CCM services, who can perform CCM, and how to bill for your time. Let's start by defining chronic care management. Chronic care management offers personal support to patients with complex needs. CCM is a care coordination service completed outside of the regular office visit for patients with 2 or more chronic conditions. The chronic conditions are expected to last at least 12 months or until the death of the patient. Those conditions must place the patient at significant risk of death, acute exacerbation or decompensation, or functional decline. We'll explore the specifics of CCM later in the module, but for now, keep in mind that chronic care management is time-focused on a patient between in-person visits and must be non-face-to-face, a minimum of at least 20 minutes per month, and billed by one provider in one clinic once per month. Which patients will benefit the most from chronic care management? According to the Centers for Medicare and Medicaid Services, 2/3 of Medicare beneficiaries have 2 or more chronic conditions. And of the $3.3 trillion the U.S. spends on healthcare each year, 90% is attributed to individuals with chronic and mental health conditions. There are a number of chronic conditions that qualify for CCM, including Alzheimer's disease and related dementia, arthritis, asthma, cancer, chronic obstructive pulmonary disease, depression, diabetes, heart failure, hypertension, and osteoporosis. With each added condition, a patient's care becomes more complex and requires more oversight. Prior to CCM, clinicians often found themselves devoting extra time to patients with chronic conditions, yet they were unable to bill for these services. Beginning in 2015, CMS established billing codes to compensate practices for providing services that help patients stay on track with their treatments and overall care plan. Let's look at CCM from the patient's perspective. In general, patients enrolled in CCM stay healthier. Without CCM, patients are on their own between appointments and may resist calling their doctor with questions, or may forget to follow their care plan. And if they have a question or concern after hours, the emergency room often becomes their first line of defense. But with CCM, patients gain the support of an entire team of dedicated health professionals who can help them manage their conditions and stay on track of their goals. CCM gives patients access to their care team around the clock. If a question or concern arises, there is always someone available to assist with urgent needs. Plus, CCM services, such as monthly check-ins, provide support to patients between visits. CCM services require a comprehensive care plan that is closely monitored and shared with patients, caregivers, and the entire care team. The plan supports disease control, health management goals, and identifies resources available to help patients and caregivers. Finally, CCM provides an internal champion for patients who will help them navigate the health system and coordinate their care. It's an extra set of eyes to ensure that treatment plans are accurate, participating providers are aligned, and medication lists are reconciled and followed. Now, let's look at how CCM supports your practice. At its core, CCM increases communication with your patients. By providing regular touchpoints and identifying a trusted resource they can turn to, CCM helps patients take an active role in their care and increases the likelihood that they will follow their care plan, adhere to their medications, and receive preventive services. CCM helps improve care coordination and health outcomes. As your patient's CCM advocate, you closely monitor all aspects of their care, including transitions in and out of the hospital or other healthcare setting. This added oversight enables you to identify and close care gaps and ensures that patients are receiving the right services at the right time. Finally, CCM is a great way to grow your practice and receive compensation for services you are likely already providing. Now that we understand how patients and practices benefit from CCM, let's look at who can provide the service. Even though a patient's care team includes a number of different people, only one provider in one clinic may bill for CCM services per calendar month. It is up to you to determine who is the best person to champion CCM services for each patient. That individual may be a medical assistant, member of the nursing staff, physician assistant, physician, or contracted third-party vendor. Although there are a number of options among the clinical team members, keep in mind that administrative personnel, such as office managers and receptionists without clinical certifications, cannot bill for services. Next, we are going to take a look at some CCM activities. Keep in mind that CCM services help you provide a higher level of care to patients who need it most. First, a few reminders. Time spent on CCM services must meet the following criteria in order to be billed. Must be non-face-to-face, must be a minimum of 20 minutes. However, the time does not need to be consecutive. And it can only be billed by one provider in one clinic once per calendar month. Some CCM activities involve direct communication with a patient over the phone, via email, or within a patient portal. But it also includes time you spend reviewing medical records and test results, coordinating care with other health professionals, and medication management. Here are some sample CCM activities to consider. CCM staff will help manage a patient's care throughout the entire health journey. They will serve as the patient's advocate, helping to coordinate care throughout the health system and with community resources. They will answer the patient's questions, ensure that all team members are aware of the care plan and any new developments that may impact the patient's health. Patients with chronic conditions often take multiple medications that may have been prescribed by a number of different providers. With CCM, the clinical team will work with patients to understand their prescriptions and provide resources to help them track their medications. CCM clinicians will provide an added level of oversight by reconciling the patient's medication list and ensuring that the patient has access to their medications, which is especially important following care transitions. Practices offering CCM must provide patients with 24-hour access to a qualified health individual who can address their urgent care needs. They also must provide multiple methods of reaching their care team beyond just the phone, such as a secure email portal. For patients, this added peace of mind of knowing that a trusted resource is just a phone call away is one of the most important benefits of CCM. The following actions are required to bill for CCM. 1. Patient consent. 2. Development of a comprehensive care plan. 3. Providing continuity of care. 4. Recording data through a certified EHR. And 5. Providing patients a way to contact your practice around the clock for urgent care management. Before you begin CCM services, you must secure the patient's consent and record their agreement in the medical record. Consent can be written or verbal. This conversation with a patient is a great opportunity to cover how chronic care management works, how the patient will benefit, the potential for copays, and you must let your patient know that they have the right to decline, transfer, or terminate CCM services at any time. If a patient has been seen by a provider within the past year, the enrollment process can be handled over the phone. If it has been more than 1 year since they were seen in person, a face-to-face visit is required for enrollment. Patients already receiving CCM services do not require new consent for each calendar month or annually. However, if a patient changes billing practitioners, they will need to consent again. Copay amounts vary based on the insurance carrier. Be sure to discuss this with your patient during the enrollment process and provide additional information based on their plan. Next, you must develop a comprehensive care plan that is documented in the EHR. The care plan is a timely, comprehensive look at the patient's overall health, with a special focus on managing their chronic conditions. Each plan can be customized based on your clinic operations, but should include a physical, mental, cognitive, psychosocial, functional, and environmental assessment, an inventory of resources and support systems available to the patient, a full medication reconciliation, as well as a review of the patient's compliance and ability to take their medications. The plan will be used throughout the patient's care journey and must be updated regularly, provided to the patient or their caregiver, and made available to the entire care team. Next, chronic care management ensures continuity of care through a designated team member who is regularly in touch with the patient. This care manager keeps a record of all specialists involved in the patient's care and ensures that everyone is current on the patient's plan and any new developments. Fourth, you must record patient data in a certified electronic health record. This may include patient demographics, medical problems, medications, and allergies. And finally, patients must have a way to contact your practice around the clock to address urgent care needs. Let's jump into the actual billing codes. There are two main codes for CCM. Non-complex CCM is billed as 99490, and complex CCM is billed as 99487. Non-complex CCM services means that the care does not require significant changes to the comprehensive care plan, and that the care provided is of low complexity regarding medical decision-making. This is a minimum of 20 minutes of non-face-to-face service provided by the clinical staff to coordinate care across providers and support patient accountability. Non-complex CCM can only be billed once per month, and the average reimbursement is $43. Complex cases fall under a different code, complex CCM or 99487. To qualify as complex CCM, you must include establishment or substantial revision to a comprehensive care plan. And, unlike standard CCM, complex CCM requires moderate or highly complex medical decision-making. Complex CCM also requires a minimum of 60 minutes of non-face-to-face time. Keep in mind that you cannot bill for complex CCM 99487 and non-complex CCM 99490 in the same calendar month. Recognizing the added complexity, time, and decision-making required for these cases, complex CCM bills at a higher rate with an average reimbursement of $94. There are a few other codes to consider. First, we have an add-on code that can be used to account for each additional 30 minutes of time related to a complex case. This code cannot be billed with non-complex CCM or 99490, but it can be billed for each 30 minutes of additional time spent beyond the initial 60 minutes of complex CCM. The average reimbursement for add-on code 99489 is $47. If a provider, including a physician, physician assistant, or nurse practitioner in your clinic, provides a minimum of 30 minutes of non-face-to-face CCM services, he or she can bill code 99491. The average reimbursement for this code is much higher at $83. Please note that this code cannot be combined with any other CCM codes within the same month. The final code we will look at is G0506. This is an add-on code that is applied to the initiating CCM visit. It can only be billed once and has an average reimbursement of $64. Code G0506 is an add-on procedure code to the visit a patient is already receiving and requires the development of a care plan. This code can only be billed once per CCM billing practitioner, but 99490 or the non-complex CCM code can also be billed in the same month. Now that you understand what CCM is and how you can bill for the service you provide, let's take a look at a few sample patients. Meet Liam. Liam is 67 years old and a Medicare beneficiary. He has type 2 diabetes and hypertension, both of which are uncontrolled. It has been over a year since Liam saw his primary care physician. Next month, Liam is scheduled for a Medicare annual wellness visit. As a patient with 2 or more chronic conditions, Liam's care team believes he would benefit from CCM services. His nurse discusses chronic care management with Liam during his Medicare annual wellness visit. She reviews what CCM is, why she believes Liam would benefit from CCM. They discuss that depending on his insurance coverage, he may have a copay, and she lets him know that he has the right to decline, transfer, or terminate CCM services at any time. With Liam's consent, his nurse records his enrollment in the electronic medical record. When it comes time to bill, she will record the following: Medicare Annual Wellness Visit code G0438 plus G0506, which is an add-on procedure code that can be billed once during an office visit in which CCM is initiated. The following week, Liam has a routine office visit to discuss his diabetes and hypertension and have his labs drawn. Based on his care plan, he begins a new diet plan and new medication for his conditions. 2 days later, his nurse calls Liam and discusses his lab results with him for 10 minutes. This does not count towards CCM because it is directly tied to the routine office visit. A few weeks later, however, Liam has questions regarding his blood sugar levels. He calls his nurse and they spend 20 minutes reviewing his diet and overall health. Because this time was not directly tied to an office visit, it counts as CCM. That month, the nurse bills for $99490, which covers 20 minutes of non-complex CCM services. The following month, the CCM nurse calls Liam to discuss his diet. They spend 10 minutes on the phone. She reaches out to him again 2 weeks later and spends 7 minutes reviewing his blood sugar levels. In total, the nurse spends 17 minutes with Liam, which means she is unable to bill for CCM because the time spent was less than the monthly minimum requirement of 20 minutes. This is Amelia. Amelia is 72 years old and a Medicare beneficiary. Amelia has congestive heart failure, chronic obstructive pulmonary disease, and hypertension. Her hypertension is uncontrolled. With 3 chronic conditions, Amelia qualifies for chronic care management services. Recently, Amelia was hospitalized with a CHF and COPD exacerbation. After Amelia was discharged and returned home from the hospital, her nurse billed for transitional care management, or TCM services. Once home, Amelia's nurse calls her to explain CCM services. After learning more about CCM and how it can help her manage her chronic conditions, Amelia verbally consents to start the program. Her nurse records the consent in the electronic health record and schedules a follow-up office visit. CCM codes cannot be billed at this time because TCM was already billed this month. The following month, Amelia reaches out to her CCM nurse with questions regarding salt in her diet. They spend 10 minutes on the phone. A few weeks later, the CCM nurse spends 30 minutes coordinating Amelia's care with her entire care team, including her primary care physician, cardiologist, and pulmonologist. Following her discussions, the nurse updates Amelia's comprehensive care plan. Next, the nurse spends 20 minutes on medication reconciliation. In that same month, Amelia calls the clinic after hours. She spends 30 minutes talking to her nurse, who helps coordinate her care and prevents Amelia from having to go to the emergency department. In total, Amelia's nurse spends 90 minutes on CCM services this month. 10 minutes when Amelia reached out with questions regarding salt in her diet. 30 minutes when the nurse coordinated care across Amelia's entire care team. 20 minutes focused on medication reconciliation, and 30 minutes when Amelia called the clinic after hours. Based on the complexity of Amelia's case and the extended amount of time dedicated to her this month, you can bill $99487 for complex chronic care management and $99489 to bill for the additional 30 minutes of complex CCM services. Let's look at an example of services that do not qualify for CCM. Amelia's nurse spends 30 minutes running and reviewing several reports to schedule patients for immunizations and checkups. Amelia appears on 2 of the lists, noting that she is in need of immunizations. The receptionist contacts Amelia and spends 10 minutes scheduling the required immunizations. Does this qualify? Actually, neither of these events qualifies for CCM. The time the nurse spent running and reviewing reports to schedule patients for immunizations was not specific to Amelia and cannot be billed. The receptionist is not an approved CCM provider and cannot bill for services. In closing, let's review some CCM best practices. CCM services offer personal support to patients with complex needs. This enhanced level of care leads to better patient outcomes, improved patient satisfaction, improved care coordination, and increased revenue. Successful CCM programs require support from providers, clinical staff, and patients. Each clinic should develop a CCM process and schedule that best fits your needs. Open communication regarding roles and responsibilities will ensure the patient's needs are put first and will reduce the likelihood of billing conflicts or errors. Personnel will need to reserve time on their schedule for phone calls, care coordination, and patient outreach. Implementing CCM services at your clinic will take some extra time and planning, but this added support will help strengthen the care that you provide and the overall patient experience. If you are interested in learning more about how to implement CCM at your clinic or to see a list of patients who might qualify for services, please contact the Nebraska Health Network team. Thank you for taking time to view this education module. For more information on chronic care management and other value-based healthcare topics, please visit nebraskahealthnetwork.com or call 402-559-6464.